and exploring. Um, so being prepared for, being able to manage those is really, really helpful. So things to have at home, irrespective of pretty much the age of your child, just having them in the house all the time, even for yourself, to be honest, it's just really, really handy. So things like having plasters, having pretty designs that, or fun designs, it helps a little bit because there's a lot of placebo effect with a plaster. Um, and the colorful ones help even more, but it doesn't really matter. Having some sterile swabs is really helpful to make sure you clean wounds properly. Some cold packs, and so you can have an ice pack, but if you have vegetable packs like a pack of peas or whatever in your freezer, that'll do as well. It doesn't have to be a specific ice pack, but having that before things like sprains and swellings, it helps to bring the swelling down. And something that I don't think most people think about to have is something called butterfly strips. So there's a picture of one here. Sometimes they're just straight. This one is actually a little bit shaped like a butterfly, for just like for cuts. I'll go through them in more detail. But those kind of things are handy to have in part as part of your equipment in your sort of first aid box. And then other things would be medicine. So and having painkillers, super helpful. I'll go through that in slightly more detail, the ibuprofen and paracetamol. Some antiseptic cream, of course, and again, it doesn't really matter which brand. I've got some pictures here. If you were along the natural route, then calendula is great. It doesn't have to be Savlon brand. It can be own brand of a supermarket, but as long as it's an antiseptic cream. Um, and antihistamines can be helpful as well, especially during the summer for insect bites and things like that, other kind of swellings, nettle stings, anything that's itchy and a bit swollen. So again, these things are just handy to have in the house, so you don't have to worry about trying to get them urgently. In terms of paracetamol and ibuprofen, I mean, I get asked about this multiple times a day, every day. Um, both of them are used for pain and for fever, but in this situation, we're talking about pain. And you can buy them over the counter, and you can give them both at the same time, or you can alternate them. With paracetamol, it's 4 doses in 24 hours from the age of 2 months. Um, it used to be 3 months, but it's technically really 3 months, but the reason the box says 2 months is because of the vaccination at 2 months. And the reason why it's 3 months is actually nothing to do with how the medicine works. It is purely the fact that we don't want you to treat fever at home in a baby under 3 months old, unless it's for the vaccination. But if they get ill and have a fever, we want you to come to hospital. And that's why the box says 3 months. That's the only reason. So actually, it's fine in small babies. We use it all the time, even in premature babies. It's fine. But anyway, that's just a clarification. So 4 doses in 24 hours. So if you're going to give it, most people know that you can give it after 4 hours, and you can, but that does mean that you then end up with a longer period later where you can't give it, because you can't keep giving it every 4 hours because you run out of doses in your 24. So sticking to every 6 hours is just a bit more practical, because you end up not having a long stretch where you can't give it at all. And then ibuprofen is 3 doses in 24 hours. So there you have 7 doses in 24 hours of a painkiller that you can give, and you can alternate or give them at the same time, depending on the timing. Things about the safety in the home, there's an awful lot about this, and there's so much out there, and a lot of it honestly is a little bit overkill. Like children do need to learn, so sometimes the hard way. um, but there are obviously some things that are too dangerous. You have to be a little bit more careful. So small objects, especially ones that are choking size. So like we're talking about like grape size, that sort of thing. If they're much smaller, it matters a lot less. So you don't have to keep every tiny fleck of something out of the way of babies. But yeah, small grape size would be that's this kind of size to keep out of reach. And then obviously sharp objects, knives, scissors, things like that. Medicines, definitely any kind of medicine. We see a lot of accidents happening with Calpol because it tastes nice. And most children know what it tastes like. And so the second that you just put it away, uh, not like not very carefully put it away and not have the top on properly, children will climb to get it and then just drink it. So that one is definitely an important one. But even other things, I've had some issues with albus oil, for example. That's, people think that's quite safe, but it's not. If you drink it, it's quite can be quite dangerous. So any kind of medicines, just keep it really out of reach, and keep it higher than you think your child can climb, because they can climb higher than you think. Um, Usually. Cleaning products. So again, we're looking at things that really can cause significant issues. So cleaning products, the gaps between the banisters. So the advice is 2.5 inches. But yeah, I mean, I don't think you need to go and measure them, but just have a little think about that if you have banisters or balconies and things like that. Windows, especially if you're anything above the ground floor, having safety catches or locks, and then safety gates on stairs, especially at the top. Okay, then we're going to go through just specific scenarios and how to manage those. So one of the commonest presentations to A&E in this sort of scenario, this sort of area, and what prompts lots of questions is about falls. So falls are really, really common. And once a baby is mobile, and that's not when they're properly mobile, but when they start rolling a bit. So that could be from 3 or 4 months, they get mobile enough to be able to roll off stuff. So we see lots of falls from what people have thought was a safe area, like from the sofa or bed or something like that. And then getting bumps to the head. So this picture there of a baby with a bump. So the basically, if the fall is from a height that's about the same height of the baby or child, then almost invariably it's okay. It is extremely difficult to cause yourself serious damage. Unless, I mean, if we're talking about a really, really small baby of a few weeks, maybe even a month or so, like that's still a little bit different. They're still so little. But if they're from 3 months onwards, a little bit more sturdy, if they fall off the side of the sofa or the bed, that's generally okay. So you don't have to rush them into A&E, depending on, obviously what you think yourself. If there's any kind of significant symptoms, that's a different story. But so that's the commonest thing. If you want to try to reduce the appearance of the bump, you can put immediate pressure to it and use a cold compress. But to be honest, that's it. You don't have to do that. It just makes the final bruise smaller, which could decrease the kind of the long, like how sore it is and how long it's painful for. But probably at that moment the child's so upset, you have other things to do than try to worry about making the bruise smaller. So it's up to you. You can do that, but you can equally just focus on giving them a cuddle and letting them be calm. If they fall from a height, so a height, by that, basically what we're thinking of is about twice the height of the child or baby. So possibly a dining table might already, for a young baby, be high enough for that. Or a changing table, something like that. That's potentially quite a high one. But anything higher, as I said, then sort of twice their height, that you do have to be a bit more cautious about. And in that case, you probably do want either take them to A&E or call an ambulance. And if there's any concern, so obviously if they fall and they get up and they're okay, you still might want to get them checked. But in that case, you kind of know that their neck will be okay. But if they really fall from a significant height, you want to try not to move the baby in case there's any issues with their spine. But yeah, that's usually quite a significant height. And the main thing then is just trying to keep them calm and still. With actual head injury, so the thing that we worry about obviously with falls is about head injuries. And lots and lots of babies and young children, they vomit after a fall, after a head bump, and it's part of like a mild concussion or something like that. And it doesn't have to be, but it can be. But that's not necessarily a reason to get them seen, because it's actually quite a common response. So you actually the limit is that you want that if they vomit 3 different separate episodes, so not like 3 vomits in a row, but vomit and then nothing for a while for at least 5-10 minutes, it's okay. And then they vomit again. Maybe after the second time, you might want to take them to A&E, but certainly the third time that they vomit after a head injury, that's when we would consider kind of doing a scan or something like that. And any of the other things in the picture here, I think, are bad enough that pretty much any parent would take a child to A&E. Like if they were really drowsy and confused, or you couldn't wake them up properly, so this is a change in level of consciousness. So they it's basically like drowsy. If they have seizures or bleeding from the ear, then not just so the from the nose is not bleeding, is if it's clear fluid. um and yeah, problems with the vision or the sensation, probably with a young child you wouldn't know. But if there's a change in the pupils, like all of these are really quite severe things. And um I've never really seen someone bring their child in for this because they will have done it earlier because the fall was significantly bad. Um, but these are the things we look at that are really for the worrying signs. Lots of people ask about whether they need to wake a child up to see. I think they do that a lot on TV or something like that to try to keep someone awake. You do not have to do that. It's a very, very normal reaction if you've had a bit of a traumatic event, that you cry first, then vomit, then go to sleep. That's really quite normal. So you just let them go to sleep. It's completely fine. The only thing, if you're worried, go and check on them to make sure that they're sleeping in a normal position. Because the only thing that you look worried about is whether they are drowsy, whether they're have reduced level of consciousness. And that's, in that case, you wouldn't be comfortably sleeping like in a normal position. You would be sort of clapped out. So if they're like that, then you take them to A&E. But again, that's not doesn't tend to happen just like that. You'd kind of know from other things. Objects in nose or ears is really, really common. Um, generally, generally it gets made worse by parents who are trying to be helpful and trying to take it out with their fingers. And of course, with the size of our fingers in a child's nostril, that's a no-win situation. You're never going to get something out, and you're just going to push it further in. So maybe don't try that. um and same with ears, like our fingers don't fit there. So um best to just leave it where it is, um unless you're so sure that you can get it. But otherwise, just leave it where it is, because it'll be much easier for us to take it out. So and then just go, if you can't get it out, just go to A&E, but leave it where it is, and then let us do it, because by the time you've pushed it further in your attempts, it gets much harder. The picture on the right here is of something called a mother's kiss. So if you've got something in one nostril, then this is a way to get it out. It's so they'll if this happens to you, then they'll show you how to do this in A&E. So basically, you pinch the clear nostril that doesn't have anything in it, and then you blow really hard into the mouth, and that force of air can push out the little whatever is in the other nostril, which is obviously a much nicer way of trying to, still not pleasant, but it's much nicer than trying to get it out with equipment and things like that. Obviously can be done by a father too, but that's just what it's called. People worry a lot about swallowed objects, and like, babies and children, they're always picking things up, and most of the time it's fine. You don't have to go, honestly, to go to A&E or a doctor every time they've swallowed something. And people worry about coins, but honestly, most of the time it's absolutely fine. And other things like that aren't metallic, you can't really see anything. So you can't even see it on an X-ray or something like that. The one thing to really worry about is a battery. So batteries are very dangerous to swallow. So if that's happened, so especially the things like, a lot of toys have those little round disc batteries, and they're really bad. So which is why all the toys they have, you need a screwdriver to open them. But in any case, if you have button batteries, so if you have any of those lying around anywhere, please keep them away, because they erode and they cause all sorts of mischief. So if you think there was a swallowed battery, do go straight to A&E. Don't wait around. And the other problem is magnets. So especially if there's matching magnets. So if you've got both of them essentially. And I have seen some tiny magnet toys being played with, and it always makes me really nervous. If you swallow them as a pair, then they can get loose and they can obviously then sort of attach via on different parts of the gut or things like that, and cause erosions and holes and things like that. So that's something of a problem. But otherwise, things just tend to pass through, and we don't. Basically, I wouldn't worry about it. The only thing is, if they get signs that it's causing an obstruction, then you go to A&E. But that's extremely rare. You know, but it's time enough to go then. And that would be if they get so obstruction would be of the gut, so they won't poo anymore, they won't pass gas, they will get a swollen belly and they'll get quite unwell. But yeah, that's extremely rare. That would be the time that I would take them to A&E, and not just because they swallowed something. Okay. So insect bites, really common. Generally, you just get a little local allergic reaction depending on your level of response. Some of them are tiny, some a bit bigger, get a bit of itching, redness, and obviously, again, depending on how much the child scratches, it might get a bit bigger looking, might get some bleeding from it. So you can wash the area, apply an ice pack. But again, if it causes too much distress, I wouldn't worry too much about doing that. If you think they're in pain, you give them ibuprofen or paracetamol, and elevate the area if that's possible. So again, if there's a lot of swelling, let's say on an arm or something like that, you can try to elevate it. So maybe if they're asleep already, you can try to lift it onto a pillow or something like that. It's obviously you can't just ask a child to keep it elevated, but it's still something to consider. So it is possible to have a kind of an allergic reaction to insect bites. So if there's quite a severe reaction, if it's much more widespread, or if there's anything that's to do with the whole body. So if there's any difficulty in breathing or any kind of rashes that spread around the whole body or swelling, that would be a reason to either call an ambulance or go straight to A&E. And they tend to improve in a couple of days. You can make it last longer if you scratch it a lot. So sometimes with small children, it's a bit longer, but that's okay. Splinters. So splinters are generally able, you can just remove them at home with some tweezers. Make sure you don't wash the area, because most splinters are wood, and water makes it swell. So it's much harder to get it out once you've washed the area. So yeah, don't do that. And if you can't remove it, generally you don't have to do anything. You just wait for it to come out, because the body just sort of gradually pushes it out over time. But just keep an eye on it to make sure it doesn't start getting infected. So maybe put some antiseptic cream on it or something like that a couple of times a day, and just keep an eye on it. But probably it'll just make its own way out. You don't have to do anything.
Shiri, there's a question on the chat.
This one I put in. Yeah. Yes.
Sorry. Yeah, there's a question on the chat. I assume this is.
I'll read it.
Okay.
So the snot sucker to remove something from the nose. Probably not. But if you use it carefully, and so could you use a snot sucker to remove something from the nose? It probably doesn't have enough suction to remove something that's quite stuck. And generally they are quite stuck, because the child will have sort of, been like playing with it and pushed it right up. But as long as you don't push it further in, it's worth a try at home. The only thing I would say is, yeah, don't just, as long as you don't push it further in, you can try anything you want. But I've not seen that work, but that doesn't mean it never will. So you don't give antihistamines. Sorry, I don't know what that's in reference to. So you don't
This
give
might be with the bites, or yeah,
with the insect bites. So you can. I mean, usually, I mean, if it's, I think most of us will have probably had a mosquito bite, and you wouldn't necessarily take antihistamines for that if you just have one or a few. But if there's a lot and the child's in like quite discomforted, you absolutely can, because it might help a bit with the swelling and with the itching. So certainly, again, it's not wrong, but think about whether you would take them yourself in that same situation. And if you think like, no, I wouldn't if I had two or three, then don't give it to the child either. Um, so it depends on the situation. So this one I think lots of people haven't heard of, but I put it in because it's actually something we see in A&E reasonably commonly, and it's one of the signs. It's one of the reasons for unexplained crying in infants. So basically, hair tourniquet syndrome. It's like basically the one of the mums, usually the mums, although there can be dads with long hair, but generally it's the mums that gets wrapped around like a toe um, or a finger, and you get this sort of indentation, and it starts to get you get swelling past the area because it's sort of basically like a tourniquet cuts off the circulation, and it's really really painful, but it can be hard to see, and the hair can be really hard to see. So like the hair has actually been removed on this one, on that picture, but you can barely see it when it does happen. So it's one of the things that if you have a baby who's just crying and you can't explain why, it's worth looking at their toes and their fingers just to make sure that this is not the case. You could pass that knowledge on to your friends. So cuts and bleeding, really common thing, of course, and that will happen to every child. Um, Priority first is to stop the bleeding. So if there's a lot of bleeding, you use a clean cloth or sterile dressing, ideally if you have it, press on the wound until it's stopped. If it goes through the dressing, don't remove it, but just put more on top. Because if you remove it, you disturb the healing process that's been going on. So you essentially start again from scratch. So try that. If you can raise the wound above the level of the heart, so it depends where it obviously is. If it's in your head, you just sit up rather than lie down. If it's in a hand or an arm, you just maybe lift it up a little bit. Um, so, and then once the bleeding has stopped, clean it, put some antiseptic cream, and then depending on what kind of wound it is, use a plaster or some bandages with a wrap, or do the butterfly. So if the edges are a little bit apart, you just gently put them together and put the butterfly stickers on, like in the picture there. If you think obviously it's really deep and you're worried that they need stitches, then please go ahead and get them checked for that. But most of the time that isn't necessary. Pulled elbow is just one that I want to mention because it's again one that lots of people haven't heard of, and it's really common in slightly older, like older babies and young children. And it's a dislocation of the elbow joint, which only happens in that age group. It doesn't happen in older children and adults. So it tends to happen on a sudden pull on a forearm or wrist. So it can be from swinging them, but often what happens is the child's tried to run away or something, and you just pulled them back, which of course happens all the time, and it just dislocates. And what happens is they cry for a little bit perhaps, but they don't really. It's not that painful, but then they just stop using it entirely. So you get a picture like this little girl here where she looks perfectly fine, and here she's happily eating an ice cream with her right hand, but the left arm is just sort of dangling there. It's not doing anything. So that's what you see. And it's actually really, really quick and easy to fix. So usually they fix it in triage. You don't even have to go and see a doctor or anything. So it's a real quick clickety clack thing, and it's done. But it ideally should be done, sooner rather than later. So if you see this happen, you kind of know what's what and get it sorted. So with animal or human bites, so animal or human bites are actually, unless it's yourself, but um, this like the flora, the bacteria in the mouth are actually can cause a lot of infection. So if the skin has been broken, you will need antibiotics by mouth. So that includes if it's your own child who bites you, or if it's another child at nursery or whatever who bite each other, or if it's a dog or whatever it is, you will need antibiotic treatment. and then making sure tetanus jab is up to date. So if you haven't vaccinated your child, this would be a time to do it rather quickly. So make sure that you tell them, and for yourself, that you mention that too, because you might need a booster. Only counts if the skin is broken, but even a tiny bit of skin broken, that counts. So burns and scalds, not uncommon, unfortunately, because of course, yeah, you look away for just a second and the child will have pulled something over them. So you do what you can about trying to avoid it, but it does occasionally still happen. So first thing you do is you put the injured area under cold running water. Depending on what you read, generally the advice is for 10 minutes, then have a 5-minute break, and then 10 more minutes. The reason for this is because you can actually give them hypothermia by putting them under cold water for too long. So do make sure, like if they really start shivering and having goosebumps, take a little break for a couple of minutes just to get them to warm up a little bit again, and then put it back. Or have the water not completely cold, but just ever so slightly off cold. But the running water as much and as early as possible, and remove the clothing. If it's completely stuck, don't start yanking it off, but if you can remove the clothing, then do that. And then on your way, like depending on how big it is, if it's really small, you don't have to go and get it checked. But if you think you might have to go to hospital, then you or even if you're staying at home, actually, to be fair, like the cling film is a brilliant way to cover it, so it doesn't stick. It helps to ease the pain and protect the area. So cling film is brilliant to thing. Should probably be on the list of equipment to have at home. Is cling film for this. And if you are going to go to hospital, then putting cling film on will be really helpful. And nothing else underneath. No creams, no antiseptic, no toothpaste or butter, just in case you've heard any of those too. But I've heard that. So nothing else. If the burn is larger than about 3 centimeters, if it's so deep or full thickness, so if it's really started blistering, or even if it's if there's no, well, yeah, if it's kind of lost the sensation, if there's burning to the hands or the face, the nipples or the genitals, or if it's from smoke and chemical and electrical burns. But honestly, you don't have to remember this list. It's just if you think, if it's more than just a tiny, like a splash of oil on the hand or something like that. If it's more than that, you go get it checked, because with burns you do have to be a little bit careful. If you are in London, the burn centres in the Chelsea and West. So if there's in any way a serious burn, then your second appointment will be in Chelsea, just as an FYI, no matter where your local hospital is, pretty much. Pills are poisons, so, and that there's a lot of things that count as this. So, and yeah, you do what you can to try to make sure everything is safe. But if it happens, try to make sure that you check exactly what it is, because almost nobody, in fact, almost nobody knows when they come in what the child is exactly taken, because they haven't brought it or they haven't taken a picture, and it makes a job much harder. So especially if it's things like cleaning products, just take a picture of the whole thing, because we need the exact brand to know what's in it, because there's so much difference. The exact thing, yeah, the exact thing, like and even things like dishwasher tablets can be quite serious. But yeah, we need to know exactly which one it is. So if you can take a picture, or take the thing with you, whatever they've taken, that would be even better. Don't even take a picture, just take the thing, and or the box of medicines or whatever it was. Take it with you and show us, and see if, as much as possible, that take note of the exact time that they took it, and if you can figure out how much they took, that would be really helpful. And don't try to make them vomit. Don't try to give them anything, except if you know it was something corrosive, something that burns, like acids or bleach, dishwasher powder, ammonia or petrol. Or if there's a blistering around about the mouth, then you give milk, or you can give them water. But otherwise not, because sometimes certain things will make, if you try to make them vomit, it makes it much worse. So don't do that as a general rule. I can't really advise exactly otherwise on what to do, but go to hospital no matter what it is, really, because even small amounts of certain things can be dangerous. Um, yeah, so it's there's so much that's possible to take, and so it's impossible to give any specific advice other than go to hospital. And then the thing about milk, if it's any corrosive substance. So bruising and fractures, so lots and lots. So every young child and every baby, they'll start bruising once they start moving around. They generally get their bruising on the bony parts. So the forehead is a super common one because, you know, when they start pulling to stand, they knock themselves on the coffee table. So they'll have a few bruises there. It's fine. It doesn't matter. And then on the shins after that, when they start running around, the shins are common. Um, if there is, you know, if there is any hint that there might be a fracture, if they're not, you know, if there's a has been a serious injury and they're not, you know, they've lost some ability, they've stopped moving, please get them checked immediately. It's quite rare for infants and young children to get very young children to get fractures, because their bones are quite bendy, but it is not impossible. Obviously, I think lots of people might be worried about safeguarding child protection things, but honestly, you're much better just to go in and just be honest about anything that and everything that's happened. And then if you end up in if you end up having to go through the safeguarding questions, the child protection questions, um, it think about it as that you're doing your bit for the children who really need it. Is my advice, because I've heard some people who are too afraid like to ask for help, and then their presentation to hospital became delayed, and then it gets more questions. So I think just don't even think about it, and if it happens, then um yeah, see it as, you know, there are children in the country who do need it, who do need the protection. So the fact that there are these sort of tick boxes that are in place, it's, you know, to catch those ones, and you're just then playing your part in helping those by not changing the checklists and the tick boxes. I can answer more about this. I don't want to go into it in too much detail, but I just know that people are afraid of this often. Accessing the NHS. So there's lots and lots of different ways to access the NHS, and I think a lot of the things are underused. And I think there's a lot of there's I think a lot of moves now. There's some advertising about going to the pharmacist, and I think they're changing some of the rules about the pharmacist being able to prescribe some things, which would be really nice. Um, but for things like this, accidents and injuries in general, they are brilliant. They're brilliant. They know so much, and they can give so much advice about all those minor injuries, like whether you have, like with a cut, if you're not sure if it's going to need stitches, go and show it to your pharmacist and say, what do you think? Do you think I need stitches? Do you think, you know, do I need to go to A&E with this? And usually, you know, they're spot on with their advice, and then it just could save you a big trip. And because in A&E you're bound, even if you get nothing, if they don't need to be there, you will spend at least 3 hours there. You know, that's a minimum. If everything is quick and normal, you'll spend 3 hours there. Whereas your pharmacist, like you'll spend 15 minutes. And it can save you a huge amount of trouble. Um, and at least then also, you know, if you do end up going to A&E because they've told you to, then you know that it's for a good reason. Midwives are health visitors, so it very much depends. Obviously, midwife would be very, very early on, so that's probably not relevant to most people here. Otherwise, your health visitor, it depends very much on your borough whether you have an accessible health visitor or not. And actually, at the moment, it's so underfunded that most people don't have an accessible health visitor. But if you are lucky enough to have one that you can contact, they're obviously extremely knowledgeable. Um, just need a lot more government funding. But that's they're a really good port of call. But pharmacists are there. They are everywhere, and they are going to be available. 111 is obviously really helpful in general, but because it's used a lot, you can end up waiting for an extremely long time. So unfortunately, while it's worth a try, you sometimes wait so long for the response that it's not really worth it. Um, your GP, and then obviously hospital, A&E, and 999. But I think out of all of these, I would say go check out your pharmacist first, if you have any worries about the injury being more severe. And most of all, I put this in every one of my slides, every one of my presentations, because it's true for everything I talk about, that you trust your gut. I might have given you advice on lots of things, but if you think, oh, that's not what she said, but I still don't think it's right, then you trust your gut and you follow that. It doesn't matter what I've said. If you think, no, something just isn't quite right, you follow that. Either way, if you think actually they've fallen from a height that's, from the table, and they've fallen down and they've carried on playing and they're fine, you don't have to go to A&E. And equally, if they've fallen from the sofa and they feel really like they're really not quite right, you take them to A&E. These are not the things I've said are guidelines. They are not rules. But your gut is your gut is the one who knows the answer, because you know your child and you know what they're normally like.
Shiri, there's a question on the
So
chat.
yeah, well, it's question time now anyway.
Yeah.
So question time, I'll stop sharing, and then we can just go straight to full proper question time. So where is the chat? Does that mean in A&E you would be waiting with a baby for a minimum of 3 hours? Pretty much, yes. So you're not waiting. Things are happening. So you go in, you get triaged within the first 10 minutes. That means you see a nurse. That nurse will take observations and we'll take a little bit of the story, check things like them. They'll do a minimum check basically, and then they do something called a triage, which means then they put you on a sort of a traffic lights signal. So if the child or the baby is deemed to be not in any serious danger or not seriously ill, they might get a green traffic light, which means that they have to be legally the rule, although it can't always be followed depending on how busy it is, but they have to be seen within 4 hours or seen by a GP in an urgent care center. So you might get actually sent to an urgent care center instead, depending on the age of the baby and the hospital, because there are different rules depending on different hospitals. And then if there is any urgency, then you'll get seen faster. So there isn't, A&E doesn't work like a supermarket queue where it's first come first serve. It's more, the sicker you are, the more you get served. But what I mean, when I said the 3 hours, with very few exceptions, by the time you've registered, then you've had the triage, waited to see either your nurse practitioner or doctor or whoever is the first person, and then being examined, and then decision made, and then the paperwork done. By the time you get to leave, it's usually about 3 hours, and that's if everything is fine. So, and people are generally very surprised about that, but that is normal. That is a really good. People come to me and say, "I've been here for an hour." It's like, yeah, that's good. The bad waits are 6 hours, or when in the winter time, the waits go much higher than that. And we try, of course, we all try our best, but we have to work in the system that we have. And very young babies will get some priority. But we're talking about a baby under a month. If it's more than a month, then they probably will just go in a normal queue, I'm afraid.
While there's a pause,
Not a reason not to go to A&E if you're worried, but it might be worth thinking about if it is really necessary and if there are other things you can do first, like going to your pharmacist or seeing your GP. But we realize that it's just not always possible. But be prepared for that wait. So just bring enough stuff with you for that length of time. I think that the expectation it makes a difference if you know that it's going to happen. Whereas if you think you're going to be out of there in an hour, you're just going to get really frustrated and think that people aren't helping you. But it unfortunately is what it is.
Oh, can I ask about mice?
Sure. What about mice? I might not be able to answer. I don't know much about mice, but a mouse bite or mice. I don't. Yeah. Tell me what you want to ask
I'm
about.
just gonna ask you instead of
Yeah.
we had a mouse in the apartment, and the droppings were everywhere. It was horrible. And our daughter's 9 months old, so she just started well, she can't crawl yet, but she's on the floor all the time.
Yeah.
So how dangerous is that?
The poo, I mean, it's fine. Yeah.
Yeah.
I mean, fine in the same sense of that generally poo is not, it's not great, and there is a risk of getting yourself an illness. So, but that would be generally an illness in the gastroenteritis kind of realm. So it doesn't mean you can't get sick from it, but it's unlikely to be a very serious one. So it's definitely worth keeping all poo away from children. But equally, it's very, very likely that they'll eat some poo in the sand pit or somewhere. They'll find it some kind of animal poo. So it's okay if she has a bit of it. So don't worry too much about that. A mouse bite would be the same as what I mentioned about animals, and but let's hope it doesn't get to that point. I saw it happen on Call the Midwife, which is why it's in my head. But no, but the droppings, yeah, not ideal.
Like we hoover every morning, and there's nothing there during the day. I just yeah, and obviously we're hoping that that mouse is gone very soon.
Yes, I hope so too for you. But honestly, don't worry. I'm sure like there'll be worse things that she'll eat without your knowledge.
Okay, thank you.
I'm gonna let you address the question now, Shiri.
It's fine. So yeah, I mean, if you missed that, you probably missed the whole first half of the presentation. But basically, nothing necessarily happens if bitten by an animal. But if you have a bite, if there's a bite by either an animal or another human, which is also an animal, then basically the saliva contains lots of bacteria, so there's this very, very significant infection risk. So if the skin has been broken at all, then that whoever has been bitten will need antibiotics. So and not just cream, but they need them by mouth. So the GP can do that, otherwise A&E. But like that's a situation where yes, you absolutely need antibiotics. No, if the skin didn't break, it's fine. As long as you know that it's another child. And you're not worried about the nursery in terms of it being an adult biting her, but that's probably a slightly weird way that I'm going here. But no, yeah, obviously children biting each other is very, very common, and no, as long as the skin didn't break, you really don't have to do anything. They'll get some bruises and stuff, and it might be a bit sore. So you can give, if they're uncomfortable, you can give them some painkillers and things like that. But you don't have to go to see a GP. Like really, we're talking like it has to be a skin break. Now, it doesn't have to be a deep one, but you would have to have seen a bit of blood. There has to be some kind of break of the skin, because otherwise the bacteria can't get in. That's the whole point. Like there has to be an entry point, and if the skin didn't break, there's no entry point. So then you don't need.
I wanted to ask about chokes when babies choke on food or whatever it is. At what point, like I think what would you do? Obviously, you back them on the back, and then at some point, somebody told me something about turning them upside down.
So that I've covered in emergencies. I've done a different talk. I've done it multiple times. We don't have the time for me, unfortunately, to go through the whole thing, but I will give a very brief answer, but I can't teach you what to do in this session. But most babies, young children, babies, they will choke, or rather they will gag. What most people call choking is actually gagging. So especially when you're like starting to wean, you're learning how to swallow, how to deal with solids. You don't know what to do yet, and then they often do this thing, or they put their mouth too full, they have to spit it out. That's gagging, and that's fine. You just calm them down. If there's a real choke, which is actually extremely rare, but if there's a real choke, that means that the baby cannot, or the child cannot breathe anymore, not properly. So that means something solid. So you can't choke on milk or on like yogurt or something, because that can't block an airway. When you say choke, that means you're saying that the airway is being blocked. But if there is something solid that you think is stuck, you encourage, first of all, if the child's alert and able to cough, you encourage them to do so. So just stay calm as much as possible, and you just keep telling them to cough and to cough. If the cough is getting weak, they're getting tired, you think the cough is not effective anymore, that's only then do you start jumping in. So there's most people jump in way too soon and make the situation worse by panicking the child. So actually keeping calm and encouraging them to cough, because their own cough is by far the best way of getting it out. So that would be the number one thing to do. But yes, if they're getting tired, then or the cough is getting weaker, you do back blows and chest thrusts. So depending on the age of the baby, if it's a young baby or an older child, the back blows are fairly similar, but it depends. The hold is different, and then the chest thrusts again are different, because you have to, when it's a baby, it's on the chest. When it's a slightly older child, from a 1 year onwards, or 1 or 2 year onwards, depending on their sort of size, you would do a modified Heimlich maneuver, which you would have seen on TV. And if it's an older child, you do a proper Heimlich. So yeah, I can't, that's a whole different session to teach you how to do that. And it goes with emergencies, because that potentially is a life-threatening emergency rather than just an accident or an injury. So unfortunately, yeah, holding upside down, please don't do that. That causes that causes trauma, and like trauma as in psychological trauma for no real good reason. So leaning them forward is good to try to let gravity help. And actually, when like with the younger babies, we might hold them. So you might hold them at an angle, like head a little bit down, certainly. But they're sort of still close to you, and there might, but it's gravity helping. But they're not like holding them upside down. That's And then what if you drop them on their head? And then you're into more deep water. So yeah, not a full answer, I'm afraid. But if you sign up to the AMI newsletter, you'll hear when I'm next doing a basic life support and other emergencies talk, because I'm sure there'll be more.
Shiri, I wanted to ask a question. There's more of a fear now in terms of insect bites, like the fear around like tick bites, and for Lyme's disease and things. So, how do you differentiate and how worried, or is it the same treatment? What do you do, in case you're worried that it might be a tick bite?
Yeah, I mean, with tick bites initially, just making sure that you remove it properly. And
How do
then
you recognize it? Just how do you even know it's a tick bite?
I mean, you see the tick will be there. So
Oh,
the tick stays. So you have to remove
oh,
it. So because the tick will be there.
I
It's
see.
the ticks don't bite and leave. Ticks suck themselves onto you and stay there to continue feeding off of you, and as long as you let them.
Right. Okay.
So there are different ways of removing them, by putting Vaseline on it, using a tweezers, using a specific tick. So if you do a lot of hiking in the country, I would recommend getting a proper tick removal thing. I'd say for things like that, just quickly Google it before you do it, because you'll forget what I've said anyway. So I'm not going to go through that in great detail. But if you do want to do, don't rush it, because it's fine. Like nothing will happen in emergency. Even if if you're outside somewhere, you could easily leave it till you get home. It's not like several hours or even days won't matter. Maybe days, maybe like one day. But get it out in a safe place, because then you want to kind of clean it and then put some antiseptic cream on the wound, or on the won't be a big wound, but just a little the area, and then it does hurt a bit to take it out. Once it's out, it's fine, but because it sort of grips its claws into you, so yeah, it does hurt a bit when you pull it out. And then basically with regard to Lyme disease, that's something that would happen later. But what will happen is that at exactly the site of that bite, that where the tick was, you'll start getting a rash around it. So it looks like a target, basically, like that tick bite is in the center, and then you that's the bullseye, and then you get sort of a dartboard around it. So if you get, but it honestly, any sort of significant like rash around that that side do get that checked out, because Lyme disease is on the up. So it's worth, but that wouldn't be an immediate thing, which is why I wouldn't have covered it here, because it's not, yeah, it's not part of accidents or injuries as such. It's just it's a different kind of illness, but it's worth mentioning.
Okay. Well, thank you so much, everyone. I see everyone's sort of logging off now, but thanks a lot. And if you do have any other questions, feel free to either contact me or Shiri, and I can forward on any questions.
Yep.
So